Hi, my name is Nicolas Mouawad. I'm the Chief of Vascular and Endovascular Surgery at McLaren Bay Region in Bay City, Michigan. Patients with peripheral arterial disease are becoming more and more complex, and they have multiple comorbidities. Severe calcification is a real problem, and it makes it quite challenging. Even as a surgeon, continuing with endovascular means can be very, very helpful. So we've been very interested in using intravascular lithotripsy for the treatment of complex, moderate, and severe calcific disease. Most of our patients that have chronic limb-threatening ischemia and significant lower extremity PAD, I think, do quite well with this, and we use it as a frontline therapy for those patients. Safety is critical when using endovascular devices, especially in complex PAD work. I've been very, very happy and impressed with the safety profile using Shockwave. Initially, I was concerned that maybe there might be distal embolization or worries about calcium moving downstream. That has not been my experience. I find it to be very safe, very effective, very nice crossing profile and coaxial support. So I'm very, very happy with it. The new Shockwave M5 Plus has fantastic new features that we're really waiting for. Three main things for me. Number one, the larger balloon size. The 8.0 balloon is great. I see a lot of complex iliac disease, so we do a lot of retrograde iliac treatment, so that size has been great in order to be able to treat things more effectively. Of course, with more distal disease in the lower extremity, the longer catheter length has been very welcome by me because of the more complex disease we see distally. And of course, time is always a big deal, so the faster pulses, reducing the time by half is probably my most favorite personally, but on behalf of the patients, I think catheter length and larger balloon sizes, the wide range that we have currently available, does the trick. So I remember this case quite vividly, actually. Patient with CLTI, surprisingly only focal left SFA or FEMPOP chronic total occlusion. Looking at the angiogram to the screen left, you really think that it's not significantly calcific. We did the angiogram, we put our crossover sheath, and ultimately we crossed with an 014 wire. For complex cases or patients with CLTI, I tend to use IVUS, and so even though on the angiogram it doesn't look like there may be significant amount of calcification, we were surprised to note on intravascular ultrasound that in fact there was significant amount of calcification that was actually occlusive, as you can see there with that chronic total occlusion. So my initial plan was to prepare the vessel. I tend to use that generally. We did that using a CSI orbital atherectomy device and crossed. You can see the next image that we were able to achieve some luminal gain, but the goal for that luminal gain was ultimately to advance a Shockwave intravascular lithotripsy balloon. The reason for that was to be able to deal with the calcium with a pulse mode. So using the Shockwave there, you can see a 5 millimeter Shockwave balloon. We did 240 pulses. Nothing further was needed. You can see the result was quite fantastic. The post-treatment stenosis was less than 10%, and the patient did really fantastic. All in a single session with really readily available tools. The result of the case was a happy patient, number one. Number two, again, we restored inline flow in a patient where, frankly, I was expecting to see more disease. We were able to do that with adjunctive atherectomy and, of course, the use of intravascular lithotripsy with a Shockwave balloon. Very, very impressive, all relatively quick, again, using the M5 Plus device. So our success was, of course, restoring flow and then, of course, having a happy patient, but also, from a procedural perspective, are we able to achieve all that relatively efficiently with a good amount of time, and that was the case, and that has been my experience. Call me if you're worried to try it. No, all joking aside, I think there's new technology, there's good opportunity to be able to take care of patients with more complex disease. And of course, we see lots of patients with calcification. We have tools now that are available for us. Shockwave does a fantastic job. It crosses well. It's on an 014 platform. I've been very happy with that. The range of the device is quite nice, again, with the M5 Plus longer catheters to treat more distal disease. So just try it, and I guarantee you'll be pleasantly surprised.